Thoracoscopy, diagnostic. Thoracoscopy, diagnostic, lungs, pericardial sac, mediastinal or pleural space, without biopsy. The physician examines the inside of the chest cavity through a rigid or flexible fiberoptic endoscope. The surgeon makes a small incision between two ribs and by blunt dissection and the use of a trocar enters the thoracic cavity. The endoscope is passed through the trocar and into the chest cavity. The lung is usually partially collapsed by instilling air into the chest through the trocar, or if general anesthesia is used, the lung may be collapsed through a double-lumen endotracheal tube inserted through the mouth into the trachea. The contents of the chest cavity are examined by direct visualization and/or the use of a video camera. Still photographs may be taken as part of the procedure. At the conclusion of the procedure, the endoscope and the trocar are removed. Thoracoscopy, surgical, with partial pulmonary decortication. With total pulmonary decortication, including intrapleural pneumonolysis. Under direct visualization through the endoscope, the physician strips away the membranous tissues covering a portion of the lung using instruments inserted into the chest through the secondary sites. Code 32652 includes intrapleural pneumonolysis, in which the physician divides the tissues attaching the lung to the wall of the chest cavity. Thoracoscopy, surgical, with control of traumatic hemorrhage. Under direct visualization through the endoscope, the physician manipulates the instruments inserted through the secondary sites and localizes the site of the bleeding. The hemorrhage is controlled by clipping or cauterizing the damaged blood vessel. Thoracoscopy, surgical, with resection plication of bully, includes any pleural procedure when performed. Under direct visualization through the endoscope, the physician manipulates the instruments inserted through the secondary sites and localizes the bully. The bulla, is removed by sharp and blunt dissection of the tissues, which often requires folding and suturing of the tissues, plication. Thoracoscopy, surgical, with parietal pleurectomy. Under direct visualization through the endoscope, the physician manipulates the instruments inserted through the secondary sites and strips away the parietal pleura from the inside surface of the chest. Thoracoscopy, surgical, with thoracic sympathectomy. Under direct visualization through the endoscope, the physician manipulates the instruments inserted through the secondary sites and localizes and isolates a portion of the sympathetic nerves as they course deeply through the chest. The sympathectomy is accomplished by clipping and/or cutting the nerves. Thoracoscopy, surgical, with pleurodesis, e.g., mechanical or chemical. Adhesion may be induced in one of two ways: by abrading the surfaces of the lung and the inside of the chest cavity, or by the installation of chemicals into the chest cavity that bath the surfaces of the lung and the inside of the chest cavity. Most commonly, a chemical solution is instilled into the chest through the endoscope or second puncture site. Thoracoscopy, surgical, with removal of clot or foreign body from pericardial sac. The clot and/or foreign body is identified and removed using a device through the endoscope or using a second instrument introduced into the area through a second insertion site in the chest. Thoracoscopy, surgical, with creation of pericardial window or partial resection of pericardial sac for drainage. Using an instrument introduced through the endoscope or through a second wound in the chest, the physician creates an opening in the pericardial sac to allow constant drainage from the sac. The drainage opening is made by the creation of a window, a flap, in the pericardium or by resecting, cutting away, a portion of the pericardium. Thoracoscopy, surgical, with excision of pericardial cyst, tumor, or mass. The cyst, tumor, or mass is identified and removed using instruments guided through the endoscope or by using instruments introduced into the area through a second or third insertion site in the chest. Thoracoscopy, surgical, with excision of mediastinal cyst, tumor, or mass. The cyst, tumor, or mass is identified and removed using instruments guided through the endoscope or by using instruments introduced into the area through a second or third insertion site in the chest. Thoracoscopy, surgical, with lobectomy, single lobe. Additional instruments may be inserted into the chest cavity through a second or third wound in the chest. Under direct visualization through the endoscope, the physician manipulates the instruments inserted through the secondary sites and clamps the blood vessels and bronchial tubes going to the area of lung to be removed. With the clamps in place, the portion of lung is removed by dividing the vessel and bronchial tubes isolated by the clamps. Any cut portions of the remaining lung tissue are repaired by suturing or clipping with surgical clips.